Welcome to the deep dive. Today we're digging into something specific and really important for certain dog owners, immunoproliferative enteropathy. You might hear it called IPE.
That's right, and we're focusing specifically on Basenjis, where this condition is, well, a known concern.
Exactly. So our goal here is to sort of break down this complex disease. We'll look at the signs, how it's diagnosed, treatment, the whole picture based on the research we've reviewed.
And it's fascinating because while it hits Basenjis specifically, it really tells us a lot about the immune system, the gut, how it all connects.
Yeah, the sources make it clear this isn't just, a simple stomach upset. It goes way beyond that.
It really does. Affects multiple systems, and the causes still a bit murky, which adds a layer of, well, mystery to it.
Okay, so let's dive in. What is IPE fundamentally in these dogs?
Right. So at its core, IPE is an immunologically mediated disease. Basically, the dog's own immune system mistakenly attacks the gut lining.
An autoimmune type of reaction.
Sort of, yes. It causes this chronic, awfully intermittent diarrhea, loss of appetite, which we call anorexia, and really noticeably weight loss over time.
And what's happening inside the gut itself?
You get this really intense inflammation, specifically immune cells, lymphocytes, and plasma cells flood into the lining of the GI tract, especially the intestines.
Okay.
Doctors often call that lymphoplasmacytic gastroenteritis or enteritis. It's just a technical term for that specific type of inflammation.
And all that inflammation. What are the downstream effects? What's the big deal?
Well, the main consequence is something called protein-losing enteropathy. The gut lining gets so damaged it can't absorb nutrients properly.
Ah, okay. So things just pass through.
Pretty much.
Yeah.
It leads to malabsorption, maldigestion. Basically, the dog can't get the goodness out of its food, and they lose protein through the damaged gut wall.
And you see signs of that in blood tests?
Yes, exactly. Our sources point to hypergammaglobulinemia, high levels of certain antibodies, specifically immunoglobulin A or IgA. That's a key marker. And like you said earlier, it's not just the gut. This can impact the immune system generally, the skin, kidneys, endocrine system, even the liver. It's quite systemic.
Wow. So who gets this? Are we talking puppies, older dogs?
Good question. The signalment that's the typical profile points pretty clearly to young or middle-aged Basenjis,
How young?
usually under 3 years old. That's the most common window.
Okay.
And another really important point from the sources is that related dogs are often affected.
Which strongly suggests genetics.
It really does. Points towards some kind of inherited predisposition.
Okay, so if you have a Basenji, maybe a young one, what are the absolute key signs you should be looking out for, the red flags?
The biggest ones are that chronic diarrhea,
Yeah.
it might come and go, and serious progressive weight loss. Sometimes the dog goes off its food, the anorexia, even before the diarrhea starts.
Anything else specific?
Yeah, a couple things. Bilaterally symmetric alopecia, that's hair loss, cut even on both sides of the body, and just a general poor body condition score. They just look thin, undernourished.
That sounds awful for the dog and scary for the owner. Would they be acting really sick, like lethargic and miserable?
You know, here's a slightly strange thing. Often, despite all this going on inside, these dogs can seem quite bright and alert.
Really?
Yeah.
Even with the weight loss and diarrhea?
Especially early on, yeah. Their attitude might seem surprisingly normal. Vomiting is also common, but it's variable. Some vomit a lot, some not so much.
This definitely sounds like it could be tricky to diagnose. What do we actually know about what causes IPE?
Yeah, this is where it gets really complex. The sources are quite clear that the exact mechanism, the pathogenesis, isn't fully understood.
Still a bit of a black box.
Pretty much. The leading idea, though, is that it's this complicated interaction. You've got an abnormal immune response happening, probably linked to the dog's specific genetic makeup.
The genotype.
Right, the genotype. And then possibly environmental factors playing a role, too, like a perfect storm situation.
And that genetic link. Do we know how it's inherited? Like, is it dominant, recessive?
Unfortunately, no. The material explicitly states the mode of inheritance is unknown right now. That's definitely an area needing more research.
Okay.
But there is an interesting link mentioned between stressful events and flare-ups.
Stress. Like what kind of stress?
Things like boarding, going to kennels, estrus cycles in females.
Yeah.
Even things like transport or vaccinations have been associated with symptoms getting worse episodically.
That's a really practical point for owners. Avoid stress if you can.
Definitely seems wise if your dog is affected. It suggests that while the underlying cause is there, Stress can kind of push things over the edge.
Okay, so diagnosis. If a vet suspects IPE in a Basenji, where do they even start? It sounds like it could look like a lot of other things.
Oh, absolutely. The list of differentials, other possible causes, is pretty long.
Like what?
You're thinking about things like lymphangiectasia, other types of inflammatory bowel disease like the lymphoplasmacytics kind we mentioned, or eosinophilic enteritis, fungal infections like histo, problems with the pancreas like EPI.
Okay, lots to rule out.
Yeah, even things like intestinal cancer, like lymphoma, or just an imbalance in gut bacteria dysbiosis, parasites like Giardia, other metabolic issues, basic worms. It's a process of elimination.
So what tests usually kick off this investigation?
Standard stuff first. Blood work, a CBC, a chemistry panel, and a urinalysis. These give you baseline info.
And what might show up on those in an IPE case?
You're often looking for low protein levels, hypoproteinemia, especially low albumin. So severe hypoglobulinemia, then the high globulins, we talk about hyperglobulinemia because of that IgA.
Right.
You might also see signs of inflammation in the white blood cells, like a mature neutrophilia, maybe a mild anemia linked to chronic disease. And if it's advanced, sometimes liver enzymes can be a bit elevated too.
That's quite a few clues from basic bloods. Any other more specific lab tests that help?
Yes, a few. Measuring that serum IgA directly confirms the hypergammaglobulinemia. There's also a test called the xylose absorption test.
What does that tell you?
It basically measures how well the small intestine is absorbing simple sugars. In IPE, it's often reduced, and how badly it's reduced can kind of correlate with how severe the disease is.
Interesting.
And some dogs might have high stomach acid or gastrin levels too, and this is really key, no single test gives you the answer.
So it's about the whole picture.
Exactly.
Yeah.
It's detective work. You put all the clinical signs, the blood results, everything together. Unlike some diseases, there's no one single marker that says, yes, it's IPD.
What about looking inside, imaging? Can X-rays or ultrasound help?
Ultrasound can be useful, yeah.
Yeah.
Sometimes it shows the small bowel wall looks diffusely thickened, maybe like 4 to 6 millimeters thick.
Okay.
But interestingly, sometimes the ultrasound can look pretty normal, even when the disease is present. It mainly helps rule out other abdominal issues.
And endoscopy, putting a camera down.
That's often the next step, yes. It lets the vet actually see the lining of the bowel. But again, it can be deceptive.
How so?
Well, it might look inflamed, clearly abnormal, but sometimes it can look surprisingly okay, visually.
So the look isn't definitive either.
Not always, which is why biopsies, taking small tissue samples during the endoscopy, are absolutely critical.
That's the key then.
That's really the cornerstone for getting a firm diagnosis. And just to be clear, there's no genetic test available right now for IPE.
Right. Biopsies are essential. So when the pathologist looks at those samples under the microscope, what are the telltale signs of IPE?
The really consistent things they see are this uniform thickening of the small bowel wall and that infiltration of the lamina propria. That's a layer in the gut lining with loads of lymphocytes and plasma cells.
The inflammation we talked about.
Precisely. They also typically see damage to the villi, those little finger-like projections that absorb nutrients. They look blunted, maybe fused together.
Which explains the malabsorption.
Exactly. It directly impacts their ability to absorb food.
Are there other things the pathologist might find in those biopsies?
Yeah. Sometimes they might see thickened folds in the stomach lining, maybe inflammation or even thinning atrophy of the stomach lining itself. Further changes to the villi, like widening and maybe slight dilation of tiny lymphatic vessels called lacteals within the villi.
Okay.
One really curious finding mentioned in the sources is that how bad the stomach looks doesn't necessarily match how bad the intestines look. They don't seem to correlate directly.
That is interesting. Does this inflammation ever show up elsewhere in the body based on pathology?
It can, yes. The sources mention associated lesions found in some cases, not all. Things like changes in the thyroid gland cells, ulcers on the ears, or the pinna.
Real?
Yeah. Also atrophy in certain stomach cells that make digestive enzymes, and even a type of kidney inflammation called glomerulonephritis.
It really does underline how systemic this can be. It's not just a gut disease.
Not at all. It's complex.
Okay, so a diagnosis is made, usually via biopsy. What's the approach to treatment? How do you manage this challenging condition?
Well, usually it's managed medically on an outpatient basis. Unless the dog's really unwell, like severely dehydrated, then they might need hospital care.
Right.
And a huge piece of advice, given that likely genetic link, is not to breed affected dogs.
Or their siblings.
Or their litter mates, exactly, just to be safe and try not to perpetuate the problem. And as we mentioned, Minimizing stress is also really important.
Makes sense. What about food? Does diet play a big role?
It definitely does. Dietary trials are a key part of management. The goal is to find a food that the specific dog tolerates well.
Any particular type of diet?
Often, vets will try diets lower in long-chain triglycerides. But really, it can be a bit of trial and error, finding what works best for that individual dog to help reduce the gut upset.
Okay. And medications, what's the main strategy there?
The primary goal with meds is to tackle that overactive immune response and calm down the inflammation. So immunosuppressive and anti-inflammatory drugs are really the mainstay.
Like steroids.
Exactly. Prednisone is very commonly used, usually starting at a higher dose for a few weeks, then carefully tapering down. But the success can be variable, unfortunately. Another drug sometimes used is chlorambucil, which is also an immunosuppressant. It needs careful monitoring, though. Other similar drugs might be tried, too, depending on the case.
Do antibiotics ever fit in?
Sometimes, yeah. If the vet suspects there's also an imbalance in the gut bacteria, that dysbiosis picture antibiotics might be helpful.
Which ones?
Things like metronidazole or tylosin are commonly mentioned, but again, how helpful they are can vary.
Right. Any other supportive things? Supplements, maybe?
Yeah, nutritional supplements are often considered. Omega-3 fatty acids, for instance. The thinking is they might help cell membranes and reduce inflammation.
Is there strong proof for that in IPE?
Well, the sources actually say there's limited specific data supporting it in IPE. Same goes for probiotics.
Ah, okay. People often recommend probiotics for gut issues.
They do, and the rationale is sound, trying to reduce dysbiosis, maybe modulate the gut's immune system. But again, specific proof of efficacy in IPE is lacking, according to our material. They're often used as supportive care, though.
Good to know. Anything that should be avoided?
Yes, anticholinergic drugs are contraindicated, so definitely avoid those.
Okay. So treatment starts. What happens next? What's the follow-up and, I guess, the long-term reality for these dogs?
Well, initially, owners often do see some improvement. The diarrhea might get better, maybe some weight stabilization or even gain. That could be encouraging.
Okay.
But recurrence of the signs is very common. It's often a condition that waxes and wanes even with treatment.
And the overall prognosis?
Unfortunately, the long-term prognosis is generally considered guarded, maybe even poor. We're often talking a lifespan post-diagnosis measured in months to maybe a few years. It's tough to manage long-term.
Wow. Well, this has certainly been a thorough look at a very, very challenging condition. Thanks for breaking that down.
You're welcome. It's complex stuff.
So just to recap quickly for everyone listening, Basenji IPE is this immune-driven disease, mainly hitting the gut in young Basenjis, but with wider effects. Watch for that chronic diarrhea, weight loss. Diagnosis is a puzzle, needing those biopsies.
Right. And treatment focuses on immunosuppression, diet, managing stress, but it's often a long road with variable success.
And clearly, as the sources show, there's still so much we don't know about the exact causes. More research is definitely needed.
Absolutely, to find better, more targeted ways to help these dogs.
For sure. And it makes you wonder, doesn't it, thinking about the genetics, the immune system, maybe environmental triggers in these Basenjis. What wider lessons could this hold, for understanding other chronic inflammatory diseases, maybe in other animals or even in us?
That's a really interesting thought to end on. The connections are often deeper than we first realize.
Definitely food for thought. Thanks again for joining us for this deep dive.